Welcome to the EM Supply Room series, where we teach you everything you need to know to be in and out of the supply room ready for your procedure in 5 minutes or less, an NYU EM APP Fellowship production. Let's get started talking about the slit lamp and its different pieces so we know how they function. The first and most important part is making sure that it's plugged in properly. The plug actually attaches to the slit lamp underneath, so into the wall and then into the bottom of the slit lamp. Next, we'll locate the power button, which is typically on the left-hand side on the flat surface facing you. When it's on, the green light should turn on and indicate that you've plugged it in and turned it on correctly. To adjust the height of the slit lamp itself, you can find this lever underneath the middle of the slit lamp. By pressing up on it, you can adjust the slit lamp up and down to match your height. Now that we've showed you how to adjust the height of the slit lamp in order to line up your eyes, let's discuss how to manipulate the eyepieces themselves. There are many numbers on the eyepieces to change them to match your prescription. However, multiple providers will be using this in the emergency department, so it's easiest to leave it set to 0 and keep your contacts or your glasses in place while using the slit lamp. Because everyone's eyes are set to different widths apart, you can lightly pull and push on the base of the eyepieces in order to adjust the width of the eyepieces to match the width of your eyes. Next, we're going to find this small knob towards the patient side of the slit lamp that keeps the slit lamp locked in place when it's not being used. This should be tightened all the way when the slit lamp is not being used so that it's not rolling freely on the table. When it needs to be used, you can loosen this knob so that the joystick can move freely. Now we're going to talk about the joystick of the slit lamp. This really has 3 functions. The first being large sweeping movements forward and back, side to side. When you're first learning how to use the slit lamp, make sure you're pushing it as far forward as you can without touching the patient's face. Beginners oftentimes make the mistake of being too far away from the patient's eye, limiting their view. You can also use the joystick to make smaller sweeping movements from side to side. This helps you sweep from the lateral edge to the nasal edge of the eye. Then you can use a larger movement to switch to the other eye and fan again. The last thing the joystick can help with is adjusting the height of the light source. If the patient is taller and you need to raise the light source higher, you can twist the joystick clockwise. If they are shorter and you need to lower the light source, you can turn the joystick counterclockwise to actually lift and lower the light source itself. Now that we've talked about how to position the light source, we're going to take some time to focus on how to manipulate different aspects of the light source in order to maximize our view of the patient's eye. First, let's look at this toggle at the very top of the slit lamp that controls the brightness and the color of the light source. All the way to the left is the brightest white light. The middle setting is slightly lighter, and the light all the way to the right is a green lamp, which we don't use frequently in the ER. Just below this toggle is the knob that controls the height of the light source. In order to make the light source smaller and shorter, you can turn the knob clockwise. To make the light source taller, you can turn the knob counterclockwise. If you turn the knob all the way clockwise, you will reach the blue filter, which can be used for fluorescein staining. The last adjustment you can make to the light source is adjusting the width of the beam by using this knob at the bottom. You can twist both sides at the same time or just one and you'll get the same effect. By twisting the knob away from you, you make the light source wider. By twisting the knob towards you, you make the light source thinner. Keeping the beam tall and wide is a helpful place to start. That way you can sweep from the temporal side to the nasal side of the eye and look for any gross abnormalities before making the beam smaller to focus on areas of concern. Now that we know how to use the different parts of the slit lamp, let's set our patient up. First, have them place their chin in the chin rest and bring their forehead all the way up towards the forehead rest. This should be in the middle of their forehead. We can see here that the forehead rest looks to be a little bit too high on our patient. If we have them sit back and twist the knob on the patient's right, it raises the chin rest to bring them into a more appropriate position for examination. To stabilize the patient during the exam, we can ask them to grab the handles on both sides of the slit lamp in order to keep them steady. Your patient is now in the optimal position for you to begin your exam. Good luck!